all the people at the Office of State Treasurer who have worked so diligently in 2022, and we look forward to them helping us stay in the check delivery business for 2023. So with that, we'll start with the first question.
Hi, Treasurer Folwell. It's AP Dillon with North State Journal.
How are you?
I'm doing good. How are you? I have
Good.
a couple quick questions about the state health plan changes. First of all, will the coverage be similar with Aetna than it was with Blue Cross? And can you share what kind of plan changes the members might see? And as a side, does this impact retirees at all?
Two great questions. Number one, it does not really impact the retirees. We do have a small percentage of retirees that are still on the indemnity plan, but nearly 90% of our 155,000 retirees are participating in the Humana Medicare Advantage program. Excuse me. That program continues to be zero premium to the member and zero cost to the taxpayer. In terms of benefit changes, I'd like to remind everybody on the call today that Blue Cross Blue Shield has never been the insurer for the state health plan. Think of it like a car and a transmission. You can change the transmission out, which is what we call the third-party administrator. It doesn't change the chassis or the body or the engine. We continue to be a self-funded plan. And these benefits that you're asking about, AP, are benefits that are set by the Board of Trustees every year. Our expectation is that we continue to freeze family premiums for the next year or so, and hopefully actually even reduce family premiums sometime during that period of time. As far as the deductibles and copays, we still have our clear pricing project, which allows where people who participate in that do not have to pay deductibles, which is very, very important. And lastly, as far as the deductibles and copays for the plan in general, we have never, in my tenure as the state treasurer, adjusted the deductibles or copays. We are trying to take advantage of our largeness like we have on our Medicare Advantage program, like we have on our pharmacy benefit management program. We're continuing to try to take advantage of our largeness regarding this third-party administration contract. We are a self-funded plan. We do not have an insurance company. These contracts have to do with the third-party administration of these benefits, and that is true yesterday, true today, and it'll be true tomorrow.
One quick follow-up.
Yes.
Clear pricing has been an ongoing project for you in the state treasurer's office. Is Aetna going to be providing more detail, more public accessible detail as to their plan and pricing costs as an administrator?
Well, the Clear Pricing Project, we have 27,000 providers of healthcare across North Carolina who have said, we don't want to be a part of secret contracts anymore. We're willing to show people what things cost. And by the way, don't want anybody to be confused about that 27,000 patients. We have one provider, Tryon Medical, has 158,000 patients in Charlotte region. So this is 27,000 providers who represent tens and hundreds of thousands of patients across North Carolina. We are going to continue to work on clear pricing, not only because it puts us on the right side of history, but it puts us on the right side of President Biden and President Trump's executive order to get rid of secret contracts in healthcare.
Hey, Treasurer, it's Jason DeBruin, North Carolina Public Radio. Hopefully this will be a question that gets a little bit in the weeds, but I am curious specifically what you hope to receive from Aetna that you weren't receiving from Blue Cross as it relates to these secret or going forward, hopefully not secret contracts. What sort of specific information, what documents, what is it specifically that you intend or hope to or expect to receive from Aetna that specifically you were not getting from Blue Cross?
Jason, great question. This RFP process was going on for over a year. by the way. It's been announced in all of our public board meetings. We have been keeping the board abreast of the how this RFP process has been evolving. And since we are now being threatened, it's been threatened that we're going to be, this contract awarding is going to be protested by the loser Blue Cross Blue Shield. There's not a lot I can say about specifically about your question. What I can tell you is that the score is the score, and the score is based on, Jason, two big components. The one component is the financial, about how much is charged per member per month to administer the plan. And the other part of the score is the technical score. And so this whole issue about who we're going to be partnering with obviously has everything to do, as far as this contract is concerned, with how they scored on those specific items. In addition to that, outside the letting of this contract, we are continuing to work on transparent healthcare, because as I said to this group before, anyone who's continues to be in favor of secret contracts is going to be on the wrong side of history. We are optimistic with Aetna that we are going to be partnering with somebody who has a more aligned interest with us regarding the transparency of healthcare.
Jason,
Can
you
I
have a
jump in?
follow-up?
I'm sorry.
Yeah, I mean, maybe I understand you can't say anything, but I guess my point is, I would really love to know what specifically you expect to get from Aetna that you're not getting from Blue Cross. I mean, I get that there's a potential challenge, and so there's 2 years before this even kicks in. But I mean, for us to be able to evaluate what it is that you're getting that's no longer secret, we have to know what it is that you're getting that's no longer secret.
Well, it's how they scored on the financial and the technical aspects.
That makes sense. What information can we get about that score? Like what underlies, what are the metrics that underlie that score?
We'll be glad to provide that to you once we're out of the silent period, and once we determine if this protest is actually filed or not.
Good deal. All right, thank you.
And Jason, we're like everybody on this call, we look forward to any follow-up questions at any time on this topic. And I also want to add, as I said to someone yesterday, it's ironic that we're doing everything we can to help you all do your jobs, because y'all have a job to do. But it seems like the people who are threatening to file this protest, no one can get them on the phone. Everything that you hear from them is through some kind of statement. So we're doing everything we can to help you do your jobs. A lot of this is, Jason, to your point, is very nuanced. But what's not nuanced is the fact that we have a responsibility, and we've demonstrated that responsibility over and over again, to always put our members first. That's true yesterday, that's true today, and that's going to be true tomorrow.
If I could ask a question, will Aetna have to rebuild the provider network or and essentially sign new contracts with medical providers that Blue Cross has now?
Well, Aetna already has a network. And I would hope, Lynn, our hope is that as the result of, is this Lynn Bonner?
Yes, it is. It's
I'll
Lynn
run
Bonner.
through that,
Yeah.
sorry.
Rose, I didn't have my glasses on.
No, this is Lynn with the, asking the network question.
Thanks, Lynn. I had it right. So, all right. So I lost my train of thought, but other than to say that, Aetna already has a network. Our hope here is that we are actually able to expand the network, increase access, increase quality, and lower cost.
Do you know how much overlap there is between the Aetna network and the Blue Cross network?
Well, we are researching that. We have actuaries that look at that kind of thing, and these actuaries are the same actuaries that the previous treasurer employed here at the treasurer's office. And so we're in the process after this protest period and the silent period is over, is to be able to give more information about that. But I want to go back to what I said earlier. Anyone who tries to paint a picture that somehow or another we're not, responsible stewards on behalf of our members is inaccurate. We have shown over and over again with our Medicare Advantage negotiations, with our pharmacy benefit management negotiations, even with our dental and vision negotiations, where we've been lowering the premiums for that service every year for the last 5 years, that all we're interested in is doing what's best for our members. That period.
At what point
There's no evidence in any other direction.
At what point will you be able to tell people who are enrolled in the health plan, yes, after 2025, you'll be able to continue with all your doctors, or, this specialist you have is out of networks? When will you be able to tell people that?
Well, our hope, obviously, and it's the reason that, we have dozens of people that are already in the building working on this transition, that there'll be more and more information available about that. But the fact is that Aetna has twice as many employees in North Carolina as Blue Cross does. Aetna runs plans larger than ours in other states. They have a great degree of expertise in not only the technical aspects of this, the financial aspects of this, but actually building a network.
Thank you.
Next.
Somebody else have a question for Treasurer?
Yeah, hi. This is Luciana with the News and Observer. So I have a follow-up question in terms of the state health plan. Will the state retain control over the formulary, or how will that work?
Thank you for joining us. As I think I explained yesterday, if you're referring to a formulary regarding prescription drugs, that formulary is with our PBM contractor. And that was true yesterday, that's true today, and that'll be true tomorrow. Obviously, if you really go into the detail of your question, Luciana, there are some pharmaceuticals that are prescribed by hospitals that do fall under the state health plan. We're not anticipating any change in that. I'll tell you what we are anticipating is a further deep dive and investigation into the 340 program to make sure that the state health plan is receiving the proper contractual discounts regarding any drugs that are distributed out of hospitals.
Okay. And so basically what you're saying is there shouldn't be any change in terms of that.
That's correct.
Okay. And what about the cost sharing design? Will there be any change in that?
If you're asking about deductibles and copays?
Yeah, I think you were talking about that at the beginning. I tuned in a little late, so I apologize if that's repeated.
It's the same answer as yesterday. In 5 years, we have not tinkered with deductibles and copays. And, for folks out there who supposedly are advocating for state employees, what has been happening for years is that the state employees, especially on the family plan and the spousal plan and the employee dependent plan, they were handed a premium sheet, but then all the changes were happening within the deductibles and copays. We have never, since I've been the treasurer, have messed around with deductibles and copays other than to lower them, period. So we have frozen family premiums. We've frozen individual premiums for now 5 years at $25 a month for the basic plan. And we have not altered copays and deductibles other than to lower them. And we expect that trend to continue far into the future.
Okay. And another question. So in terms of prior authorizations, what is specified in the plan about that?
Was your question about how things are going to be different regarding prior authorizations?
Yeah, is there going to be any change for people?
I don't expect any change along those lines. I will report to you that if you are actually humble yourself enough, not you specifically, to actually listen to the people who have the responsibility for providing health care, I'm not sure that the pre-authorization topic is as clear as it needs to be. Somebody told me just in the last 5 days of a situation where somebody was on the table getting a normal, nothing's normal about a heart procedure, but getting a stent or something like that. And while they were on the table, they had a heart attack, which resulted in the surgeon having to open their chest and do open heart surgery. And it got denied somehow. I mean, how are you supposed to get a pre-authorization when someone's laying on the table and you've got this situation like this? I want to, in addition to the 340 drug program that the hospitals, and it's nationally reported, are making lots and lots and lots of money on. In addition to looking at that, I think we need to also look at the pre-authorization process. We don't want to confuse activity with accomplishment. And what I specifically want to look at is a word that goes all the way back to when I was in charge of the unemployment agency. It's called auto adjudication. I want to see exactly how many things that come under pre-authorization that are actually just auto adjudicated. So that's an example in many cases of activity without accomplishment. The purpose of having pre-authorization is to somehow, maintain, the cost control of the state health plan. But once again, we don't want to confuse activity with accomplishment. Pre-authorization should be, built on the chassis of doing just what I said a few moments ago, not making people jump through hoops that are going to be automatically approved.
Okay, so has Aetna has said they're going to work on that to, not have people jumping through hoops to get services, or is there some sort of commitment on that end?
No, I haven't had any conversation and not aware of any conversation with them. All I know is that in our preliminary conversation, since this contract was let several weeks ago, that their willingness to partner with us to deal with some of these issues we are very excited about that.
Can I jump in with another question?
Thank you.
Lynn, let's go to
It's-
someone else. Let's go to someone
okay.
else first, please. Thank you. Anybody else?
This is Travis with WRL. Can you hear me okay?
Yes. Hey, Travis.
I think there are probably more questions to ask about the health plan, but if we could talk quickly about BlackRock.
Glad to.
When you announced that you wanted the head to resign, most of your release focused on climate change. Help me to understand why it's a bad idea to try to address climate change in investment decisions.
Well, my answer to you, Travis, is that the climate is changing. Now, if you want to have a conversation about carbon, that's a whole different topic. I think carbon.
I'm sorry, you don't believe that the amount of carbon in the atmosphere is related to to climate change? That's a whole different topic.
What I'm saying to you is that almost 1% of the carbon that's going up in the air right now is things associated with natural gas companies burning off excess energy. There needs to be a more comprehensive policy regarding carbon and climate change, specifically about BlackRock. What we did is we governed, we led, where you heard all these other announcements of people pulling their money away from BlackRock. As a fiduciary, when somebody has offered me the highest value for the lowest cost with the highest margin of safety, then I have a responsibility to leave the assets there, which is what I did. The other thing that we did is we took away BlackRock's ability to vote our proxies, which we think was their way of politicizing the pension assets of the public servants of North Carolina. And then the last piece that you just mentioned was for Larry Fink's departure. This is not only impacting us at the pension plan, I'm seeing it impact us as the chair of the State Banking Commission through the bank underwriting standards that are being coming through these ESG policies. I'm also seeing it as the chair of the Local Government Commission. where we have some communities that are having difficulty paying their pension and healthcare payments for their public service workers. But yet when they're being scored by the rating agencies, they're asked not what are you doing to properly invest in your water and sewer infrastructure, but how many electric vehicles do you have? What I'm saying to you, Travis, is that we need to have a more comprehensive conversation about ESG, about climate change, and about carbon. What I can tell you that specifically about the pension plan is there are reports across the country and across the United States that show that these ESG funds that have an ESG focus have underperformed. It's wacky. And as you know, I think you know this example in one of the major ESG funds in the United States, Tesla, who I would consider to be an ESG company, was taken out of the ESG index, and an oil company was put in the ESG index. My point is that we need to have a more comprehensive conversation about climate change and carbon and issues associated with that.
Well, but help me to understand kind of fundamentally, why is it wrong to value the health of the planet, avoiding a significant rise in ocean level? Why is money more important than those issues?
Well, for number one is that nobody said there's anything specifically wrong about it, but the fact is this is not my money. This money belongs to the retirees, those that teach, protect, and serve, and taxpayers like them. And to have our pension assets politicized because of somebody making a singular decision to focus on this is what we led on to stop.
Well, just to kind of use your analogy, it's not my money. It's not your earth either. I mean, why is trying to address these things less important than making a stronger return?
Well, because I'm a fiduciary, I have a loyalty and duty of care. And, let's start with the fact, Travis, that I'm a conservative. The root word of conservative is to conserve. So I don't think anybody who knows me or knows my habits could ever underestimate that I don't like wasting things. I don't use plastic bottles and all kinds of things associated with that. But we'll be glad to talk about it at some other point.
I appreciate that. Returning to the healthcare plan, and this will be my last question. Can you just give employees a timeline for, I mean, obviously there are a lot of questions. There are always going to be when there's a shift like this and it takes time. What is the timeline to share, to have that information start rolling to employees?
Well, that's why the transition team is already here. As I said earlier, we have a track record as well as a responsibility for this, for us to as we transition into the Aetna as the third party administrator. I still read reports across this state where people are reporting that Blue Cross Blue Shield has been our insurer for 43 years. That is inaccurate and false. They are our back office operator, period. That's all they are. And as soon as information is available, we'll be giving it to them. But the premise of your question is almost such that, somehow or another, we're irresponsible people in terms of even bidding this, letting them have this contract. Obviously, the Blue Cross lobbyists who are working on this, are taking the exact same tact. But how dare us even put this contract out for bid? And I'll tell you what I told the CEO and the chairman of the board when they were asking about the procedure for this protest. And I informed them that we'll be learning as they learn. And the CEO seemed a little perplexed by that. And I explained, as I'm going to explain to you, we don't have any knowledge in this building where anyone has ever protested Blue Cross Blue Shield getting this contract for the last 43 years. So we're going to be dealing with this exercise called a protest alongside of Blue Cross Blue Shield because we have no evidence that we've gone through a process like this when they got the contract every 3 to 5 years over the last 40.
Well, just to clarify, the question is solely like, what sort of timetable should employees expect for more information to roll out?
We're going to be sitting down with the team. The Aetna team's going to be here, the senior management, the next couple of weeks. We're going to be laying out timeframes and deliverables, and as soon as that is available, we'll be sharing that with our members and stakeholder groups.
Thank you.
Is there, can I ask questions for Rose Hoban?
Yes.
So just, sort of, Lynn asked most of my questions. My question is, was there any sort of like assessment done of the potential like disruption to members, like with their, being able to keep their providers and whatnot? Was there like a disruption assessment, or a change assessment that was done? And is that something that could be available?
Yes. Rose, once we get past this protest period, all that information regarding the questions about member disruption will be addressed when that is when we're out of the quiet period and that's more available. I will tell you that the Medicare Advantage folks have been disrupted, if my memory is right, 4 times in the last 11 years. Before I was the state treasurer, we had 2 Medicare Advantage providers, 2. And then a few years after that, under Treasurer Cowell, who, by the way, volunteered and raised her hand to take responsibility for this state health plan when no one else would. So she deserves credit for that. Then Rose is talking about Medicare Advantage. We're talking about 150,000 people here. And then that having 2 vendors to choose from in the Medicare Advantage program became 1. And then when we had 1 vendor, she did actually, she let that contract out in her last year of her term, I believe, where United Healthcare got all the business. And then 3 years later, with me being the state treasurer, we put that business back out for bid. And we had some very healthy competition going on that resulted in 0 premium to the member, $4 a month premium to the dependent, and no cost to the taxpayers. Those people who advocate for low and fixed income individuals should be doing backflips over that. It was a fantastic negotiation that saves the state health plan potentially $1 billion over 5 years. And also, if you want to talk about the PBM, Treasurer Cowell had a different PBM manager, and then I think she went with CVS Caremark, and that contract went live on the day I was sworn in. So my point of saying that to you is that there have been transitions going on inside the state health plan, many of them during Treasurer Cowell's tenure and during my tenure. And in every single situation, everything is about what is in the best interest of our members, period.
Okay, thank you.
And by the way, factually, I don't have the precise number, but I think we're over 90%, or right at 90% of those that can avail themselves of Medicare Advantage programs are doing so. That number was 0 10 years ago. And now it's nearly up to 85 or 90%. So that tells you what a great job that we've done, and the decisions that people have made when we push the decision and power down to them. The comfort level, when I go across North Carolina, that people have with our Medicare Advantage product, they're ecstatic about the 0 premium. They don't even know that it's saving the taxpayers money. Is a result of us putting all the focus on what's in the best interest of the members. Any follow up? And then we'll go back to Lynn.
No, I'm good, thanks.
Can I jump back in?
Yes.
Great.
Who is that?
It's Lynn.
Yeah, I just said we'll go back to Lynn.
Okay. When you first won this office, we had an interview, and I think I recall you saying, we're a big purchaser of healthcare in this state. Why aren't we getting better prices? So I'm wondering whether this change in administrator will lead to lower costs for the health plan. If the answer is yes, if so, how will that happen? And how will the public be able to see that?
Well, the public is already seeing our focus on this, Lynn, by freezing premiums and either freezing or lowering deductibles and copays. So what you're asking me about versus what I said 5 years ago is already taking place. I also want to remind all of you of what State Auditor Beth Wood said 12 years ago. And I almost quote verbatim in her findings against this state health plan. The state health plan, even though it spends over $2 billion per year for healthcare for public service workers, does not have access to vendor contracts. Therefore, the auditors of the state health plan cannot verify that the members are getting the proper contractual discount. Nothing really has changed too much since State Auditor Beth Wood said that 12 years ago. We want to end that sentence. We want to be able to assure people that when they get a bill in the mail, that they are receiving the proper contractual discounts. Because this goes back to something that you should really care about, Lynn, and that is the incorrect billing, misbilling, billing for things that didn't occur, and then the ultimate weaponization of people's credit scores when they don't pay their bill, which drives up their cost of living in every other aspect of their life. That's how all this relates. So whatever I said to you, when I applied for the position to be the state treasurer of North Carolina and receive this, the opportunity to do this, nothing has changed since then.
So if I can kind of get a clarification, so is the change in third-party administrator, are you expecting that will go toward the goal of further lowering costs?
Yes.
Okay.
Everything I do is about increasing, having better member experience and lowering cost to them.
And where will the public see those lower costs?
Well, Lynn, let's start with the fact that our state healthcare costs and prescription drug costs are going up at double digits a year. The funding increase that we receive from the General Assembly is 4 to 6% a year. So just starting with that, even though people can't see it, they're enjoying it. Anytime your costs are doing this and your appropriations doing this, and the cost to the member is staying this like this, that is a benefit in and of itself. And that's been happening every year that I've been the state treasurer. Does that make sense?
I have to think about it, but I don't have any more questions at this point. Thanks a
Well,
lot.
I don't, Lynn.
Yeah.
You don't need to think about it. The cost, if you see my hand, are doing this.
Okay, right.
Okay. The appropriation from the General Assembly is here. We have frozen family premiums and deductibles here for 5 years. If we would have changed deductibles and copays and risen premiums equal to what we weren't getting reimbursed, given how much costs are going up, and they're going up for you also, by the way, then that would be a detriment to our members. So they're already receiving the benefit. Our goal is for us to actually produce more benefit. And I've said it once, if I've said it 1,000 times, this is a self-funded insurance company at the state health plan. Our third-party administrator sends us bills for $2 to $280 million every 30 days. And the point of me saying that to you is that you cannot have an insurance company that's made up of people my age, especially with my hobbies. You have to have an insurance company offset with younger, healthier people. You can see by the combined ratio, you can see it by the participation rate, you can see it by just talking, humbling yourself and talking to the average person, state employee in this state, that they're having to make decisions between mortgage and health care premiums, energy and healthcare premiums, food and healthcare premiums, living their life and healthcare premiums, not to mention what's happened to the cost of all those other things, especially over the last 2 or 3 years. And my point of saying that to you is that this is very, very important because we have to lower, not just freeze, we have to lower family premiums so that we can attract younger, healthier people to this plan to offset people like myself, my age.
Thank you.
It's an insurance company. You can't have a car insurance company with all bad drivers or bad health risk. Any follow-up questions? Anybody else got a question? Okay, given that, we appreciate your participation. As you know, we're here to help anybody who might have any follow-up questions. Later on this afternoon, we are having our local government commission meeting, which is normally follows the council of state meeting, which got canceled this month. Those of you who can remain interested in the issues going on with local government need to, you're welcome to tune into those meetings. I will say, and knocking on wood, that this is a short agenda for today's meeting. We normally have a more full agenda in October, November, and December because people are trying to get bonds to the market before the close of the year. But anybody who has any questions about anything that's going on with the local government commission, feel free to either tune in today or follow with questions. And regarding this issue of BlackRock or the transition of the third party administrating of the state health plan from Blue Cross to Aetna 2 years from now, if you have any further questions about that, don't hesitate to reach out. Thank you for joining us and Happy New Year.